My dear student, today I like to highlight with all of you very nice, very much demandful topics. This is called anemia. Anemia is very much important for all discipline, all specialization. It may be surgery, maybe obstetrics and gynae, maybe in medicine, maybe pediatrics, maybe eye, maybe everywhere. Blood, that is anemia is the very much important topics. Remember this one. Now, first of all, what do we mean by anemia? Anemia may be defined as when hemoglobin concentration fall below the normal range, irrespective of age and sex. Remember this. Now how it classified? How the anemia is classified? Anemia classified in different methods. Number one, morphological classification. Remember this, morphological classification on the basis of the MCB, NCH, MCHC. It is three types: microcytic hypochromic anemia, normocytic normochromic anemia, then macrocytic anemia. Remember this. Then another one is etiological classification. What is the etiological classification? It's the etiology. It may be due to acute blood loss. Number one, due to blood loss. Number two, due to hemolytic anemia. Number three, due to impaired RBC production. Remember this one. Everything in your book, you look in your books. Everything is present in your book. Next, you think how are the acute blood loss? Acute blood loss means gunshot injury. Any gunshot injury, any step injury, that acutely loss of blood. This is called acute blood loss. Another one is chronic blood loss. Chronic blood loss means due to peptic ulcer disease, due to portal hypertension, due to hookworm infestation, due to menorrhagia, due to hemorrhoids, chronic blood loss. This is called chronic blood loss anemia. Number two, I told you about the hemolytic anemia, that is excessive destruction of the RBC. Excessive destruction of the RBC, it may two types. One is intracorpuscular defect, another one is extracorpuscular defect. Very good. Intracorpuscular defect means it may be defect in the membrane defect, RBC membrane defect, RBC enzyme defect, RBC hemoglobin defect. Remember this one. Then another one is extracorpuscular defect. Extracorpuscular defect means autoantibody mediated, old antibody, warm antibody mediated anemia. This is called your extracorpuscular defect. Next one is impaired RBC production. Due to inadequate RBC production, there are several factors. Impaired RBC production, okay? Impaired RBC production means impaired due to some, first of all, due to some deficiency or nutrition, like iron deficiency, folic acid deficiency, vitamin B12 deficiency, vitamin C deficiency, overall zinc deficiency. This is called the nutrient deficiency. Next one is due to failure of RBC. Failure of RBC, failure of bone marrow failure. Bone marrow failure due to aplastic anemia. Bone marrow failure due to leukemia. Bone marrow failure due to lymphoma. This is called failure to bone marrow production of the RBC. This is three types. Remember this one. Number one, this is acute blood loss anemia. Number two, hemolytic anemia. Number three, impaired RBC production. Remember this one. You should remember this one. Next, one thing everybody should know. I told you in definition. What is anemia? Anemia may be defined as when hemoglobin concentration fall below the normal limit. Below the normal limit, irrespective of sex and age. This is called anemia. Now you should know how the hemoglobin is synthesis in our body. How the hemoglobin is synthesized in our body. Everybody should know this one. How the hemoglobin is synthesized in our body. Look to blackboard. First of all, like this is the hemoglobin synthesized from the Krebs cycle. Acetic acid, from the acetic acid. First of all, acetic acid converted into acetic acid. Acetic acid is converted into succinyl CoA. Succinyl CoA. Then 2 molecules of succinyl CoA. Plus 2 molecules of glycine makes 2 molecules of one chiral ring. Then 4 chiral ring constitute photoporphyrin. Photoporphyrin 9. Photoporphyrin 9. This photoporphyrin 9 binds with ferrous iron. Then produce heme. Remember this one. Then heme bind with polypeptide chain. Therefore polypeptide chain. Then produce hemoglobin chain. There is several types of hemoglobin chain. Alpha chain, beta chain, gamma chain, delta chain. You should remember this one. There is how many types of hemoglobin chain? There are 4. Remember this one. This is alpha chain, beta chain, gamma chain, and delta chain. This is the all are hemoglobin chain. Okay? 2 alpha, 2 beta chain constitute hemoglobin A. 2 alpha, 2 delta chain constitute hemoglobin A2, and 2 alpha chain and 2 gamma chain. 2 gamma chain constitute hemoglobin fetal hemoglobin. It is about 97%. It is about 2 to 3%. It is about less than 0.5%. Remember this one. There are 3 types of hemoglobin. Look there. One is hemoglobin A, adult hemoglobin. A means adult hemoglobin. Number 2, hemoglobin A2. This is about 2 to 3%. Number 3 one is fetal hemoglobin. Is less than 5.5%. Remember this one. You should even the pathophysiology of the out of hemoglobin synthesis in our body. You should know this one. You should know. Now I like to highlight my that slide presentation. But slide presentation, everything is not enough. Slide presentation also in your book haven't anything. No one is having in your book. There are no process how the hemoglobin is synthesized is not written in your book, is it? I told for myself like this. Next, you go in your slide. Look, what is hemoglobin? What is anemia? Already I told. Reduction hemoglobin concentration less than normal level irrespective of sex and age. Remember this one. Next one is what are the factors responsible for hemoglobin formation? This is all are the nutrients. What are the nutrients? You look, you take the picture, only picture, never write. You haven't more time for that. That's